Recently, the innovation of generative AI has transformed the way people work and live and learn. In the area of aging, generative AI can be leveraged based on its algorithms and deep machine learning to provide specific and targeted assistance for the elderly. The challenges faced by the elderly include decline in the physical abilities of the individuals from biophysical impact, chronic disease, degeneration, decrease in mobility. Also, there is a cognitive decline due to the lack of exposure, the isolation, and can also result in emotional and psychological factors like loneliness and depression. The social isolation can be significant partly because of the lack of people around, the accessibility for company due to maybe mobility issues, and generative AI has a role to play. The potential applications of generative AI here are in the area of personalized care, where you can act as a personal health assistant to provide advice and comfort and to show the possible avenues to improve health. And this can be with the current advancement in generative AI, be a conversational tool to help with the individual. The other areas that it can help is in cognitive stimulation, as the generative AI has the ability to customize and personalize advice and teaching to the individual. It can provide sufficient stimulation to the individual in a conversational manner to help them improve and remain cognitively alert. Also, the use of generative AI can be as a companion and help with social connectivity. We can engage with other individuals through use of technology, but generative AI can understand the needs and challenges and concerns of the individual through appropriate prompting or conversations, and from which it can then help individuals in keeping them company and engaging with them. There has been use cases in Japan where they have worked as an android to help individuals who live alone to overcome loneliness through engagement. Personalized health recommendation is one of the areas the generative AI can help. It can help in data collection through the various wearable devices, and through which specific recommendations from the healthcare professionals can be incorporated into the generative AI database to help the individual work on a conversational level to obtain advice and strategies to improve health. It can also help based on the algorithms to predict the potential for emergencies or deterioration in health or risk factors for depression. So predictive analytics is one of the areas in which generative AI can help. And it can also adapt intervention. Physician prescribed intervention can be modified and adapted to the individual needs. So it's a customized and personalized advice can be created with the use of generative AI. The cognitive stimulation component of generative AI has been significant. There are various tools that have been developed with generative AI as brain stimulating games that to help the prevent the decline of cognitive function through various techniques like to improve memory, adding cognitive load so as to create new synapses, which then can help the individual keep cognitive function going. The role of reminiscent therapy with adequate amount of data being uploaded to generative AI, it can provide sufficient reminiscence to help increase wellness. There's strong evidence structured reminiscence improve wellness in the elderly. It can also help with memory assistance by prompting and allowing the individual to base on the knowledge database it has. So this can be very useful with ambient clinical recording of conversations with special earpieces to help the individual engage with others through good memory. Social engagement and connectiveness is where the AI can work with various video conferencing software to help facilitate video calls and group activities to combat loneliness, and this can promote social engagement. Online communities can be used as a means of engagement to keep the elderly engaged and cognitively challenged to keep them active. And the selection of like-minded individuals can be assisted with the use generative AI. It also gives an opportunity for volunteering opportunities. It's part of the Ikigai framework to help people feel engaged, to be engaged in something that's meaningful and useful. An elderly individual who has had good experience in work life, who may be able to use his competencies and skill set to help others get better in life, and this AI can help to match individuals and provide that personalized counseling and the giving back to society. The other area in which generative AI may be useful is in the area of caregiver assistant and respite care. So where individuals can take some time off and the generative AI can help to keep these individuals company, help them with engaging them in conversations and keeping them with the sort of stimulation that keeps them out of loneliness and push and avoids depression. You can provide emotional support to the individuals through conversation language, and this is because of the concept of effective computing, where computing can help in the emotional well-being through a conversation with the choice of words and language used to help that individual overcome negative emotions. It can also help with the use of robotics to help with task assistance. Easy task assistance around the home can be obtained with the use of AI and robotics. Finally, I think that generative AI has got a significant role in empowering the elderly, and there's a future uh, in which it may be a useful companion. It can advance research by collecting data, and the generative AI can be further expanded to the level of personalized and very bespoke can support for the individual. It is important to understand the ethical considerations of data privacy in terms of security, but these can be designed in such a way that they do not go to the cloud. It can be kept locally and in a secure environment. I hope this short lecture has helped you understand the role of generative AI in healthcare.